Prior to any InnoPen treatment, it is important to analyze the skin to determine high-risk conditions and rule out any possible contraindications. Cautionary conditions include history of herpes simplex infections, diabetes, eczema, psoriasis, and other chronic conditions, history of actinic solar keratosis, keloid scars or raised scarring, or the presence of raised moles, warts, or raised lesions in the treatment area. Lastly, higher Fitzpatrick skin types 4 through 6. Absolute contraindications include active bacterial or fungal infections, new scar tissue or wounds less than 6 months old, rosacea or blood clotting problems, collagen vascular disease, immunosuppression, cardiac abnormalities, scleroderma, and excessive sunburn and irritation. These conditions should never be treated with InnoPen and should be avoided until resolved. A comprehensive list of cautions and contraindications can be found on page 13 of the user manual. When preparing for the InnoPen treatment, the skin should be cleansed thoroughly to remove all traces of makeup, dirt, and oil. A gentle exfoliating treatment or manual scrub is recommended to remove the dead skin cells of the stratum corneum to better prepare the skin to achieve the desired results. Next, apply an even layer of Numb Master to the treatment area and leave on for 20 to 25 minutes or until it reaches the climax of numbing efficacy. Proper occlusion is recommended to expedite the numbing process and to prevent dry out. Numb Master topical anesthetic is made with liposomal technology specifically for microneedling treatments. It glides on and wipes away easily, and it will not leave any greasy residue. This in mind, Numb Master is also ideal for many other clinical treatments. After allowing the appropriate timing, completely remove the anesthetic cream with gauze or sponges. Disinfect the treatment area as the last step of the preparation phase. Use antiseptic wipes or alcohol wipes to sterilize the treatment area completely. This will remove any unwanted contaminants still present on the skin. When assessing the treatment area, divide into small sections to determine the appropriate needle depth and to maximize the penetration and benefits of the treatment solution. Apply the clinical solution evenly over the first section of the treatment area. For this particular treatment, we are using Vital W to utilize the hydration of hyaluronic acid and the skin-perfecting benefits of peptides for an optimal treatment result. Hold the skin taut by gently pulling down with thumb and index finger of your free hand to assist in more even needle penetration. Be sure to hold the InnoPen on the black portion, avoiding contact with the depth ring, which may turn if force is applied to it during the treatment. It is important to align the device perpendicular to the skin during the microneedling process. To begin needling, keep the InnoTip's outer safety covering in contact with the skin. Gently push down to activate the stamping motion of the needles. Before moving the InnoPen, simply release pressure to retract the needles away from the skin, which deactivates the needling process. This ensures the safest and the most effective method of microneedling. Similar to an index finger clicking on a computer mouse, operate the InnoTip in the same fashion, using the wrist as the InnoTip glides across the skin, making sure the clicking noise is heard with each motion. Unlike other microneedling devices, there is no need to lift the device off the skin to create the perfect stamping motion for concentrated collagen and elastin growth. InnoPen does it with every click. Never drag InnoPen across the skin without releasing pressure on the tip. Dragging oscillating needles across the skin in any motion, either linear or circular, can cause a variety of complications, which is inevitable for all other microneedling devices that use an open tip system. These complications include scratching, unnecessary microincisions, uneven treatment results, excess inflammation, and post-inflammatory hyperpigmentation. For the first pass, treat in a horizontal motion moving outward on the face. For the second pass, treat with a vertical motion moving upwards. For the third pass, treat in a diagonal fashion moving upwards and outwards. 3 passes per area are all that is necessary for an optimal treatment. After the microchannels are created, use the remaining clinical solution to gently massage with your fingertips to facilitate greater penetration and absorption, and carefully wipe away any pinpoint bleeding with a sterile gauze pad. Proceed to treat all sections in the same fashion while abiding by the appropriate needle depths, according to the chart on page 15 of the user manual. Be sure that the skin reaches the optimal clinical endpoint, which is mild, even erythema with very slight edema in the treatment area. Avoid severe or uneven skin redness or excessive erythema. Slight warmth or tingling in the treatment area is to be expected. Directly following the InnoPen treatment, apply the MTS Peptide Aqua Gel Mask, which has been refrigerated prior to use. This mask will instantly cool, soothe, and calm the treatment area while restoring moisture into the skin. The unique ingredients found in the MTS Peptide Aqua Gel Mask will expedite the skin recovery and further enhance the effectiveness of the applied solutions. This mask will help to immediately relieve burning, stinging, and redness of the skin while comforting irritation. Leave on for 10 to 20 minutes. It is recommended to send patients home with the MTS Peptide Aqua Gel Mask post-treatment following other clinical procedures such as chemical peels, laser, IPL, and dermabrasion for fast and safe recovery while managing discomfort and to prevent moisture loss. After removing the mask, apply either the MTS Hyaluronic Peptide Serum or the MTS StemPep Serum to enhance the effects of the procedure by infusing essential hydration and nutrients into the skin. Followed by applying the MTS StemPep Moisturizer or the MTS Peptide Moisturizer for optimal hydration and safe recovery. Lastly, apply the MTS Sun Protective Cream, a broad-spectrum UVA-UVB chemical-free sunscreen with SPF 30 designed for post-cosmetic procedures. This will protect the skin post-procedure from harmful UV rays without leaving any white or chalky residue. Swelling and redness is normal immediately after the treatment. The treated area will appear similar to that of a moderate to severely sunburned skin. Minor pain and/or discomfort of elevated warmth and tightness can be experienced, which will start to subside after 1 to 2 hours. Fast recovery is normally observed within the first 24 hours after the treatment, with only slight redness remaining the following day. The skin will feel tight and dry for the first 3 days post-treatment. Some skin might scab after 3 days post-procedure. It should not be touched or picked on to avoid any infections and left to fall off naturally. Patients may return to their regular skincare products approximately 2 to 3 days after, or as soon as it is comfortable to do so. Be sure to advise to avoid unprotected sun exposure for at least 7 to 10 days after the treatment. Take precautions against direct sun exposure and absolutely no tanning beds. Always apply a broad-spectrum UVA-UVB chemical-free sunscreen with SPF 30+ designed for post-cosmetic procedures. Also avoid vigorous exercising or activity for at least 48 hours post-treatment. Avoid hot showers, steam baths, saunas, or swimming pools at least 48 hours following the treatment. The client is not to apply makeup on the same day of treatment. Avoid the use of sensitizing drugs, skin cosmetics, or cosmetics that contain mineral oils, Vaseline, lanolin, petroleum, acids, or alcohol-based toners. It is recommended to use products specifically made by Clinical Resolution Laboratory post-treatment to avoid risk of allergic reaction and enhance the benefits and results from microneedling. Go to clinicalresolution.com for a full list of products. Rest assured and feel comfort in knowing that you're in the right hands with Clinical Resolution Laboratory, the microneedling experts.